to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking liposuction and tummy tucks. We talked about liposuction, but I have Michelle in San Francisco. She's on the air with us right now, and she has got a question for the doctor. Michelle, San Francisco, are you there?
Yes, I am.
Hi, Michelle. What's your question for the doctor?
Well, I heard of a study where they say that in stop liposuction, the fat comes back in other places eventually.
All right, so Michelle wants to know, if you have liposuction, will the fat come back to other areas?
It can. I mean, the goal with liposuction, it is a partnership. So we definitely want to maintain a stable platform, so a stable weight, so that the results will be long-lasting. If you do gain weight, it's going to depend on your body. A lot of times it will come back in a different area because we've removed those fat cells. So the area where the fat was, those cells are now diminished or decreased. But other areas may take up the fat. There are some folks who will get it back in the same place, but that's unusual. Most commonly, it comes back more proportionally, which still looks better.
Okay, so if fat does, if you see fat growing back in some areas where you didn't have it before, what? Just work out harder, or can you?
Well, that's just it. Since it goes there because we've gained a little weight, if we lose the weight, it tends to go away.
Oh, okay, good.
So it does work.
All right. So just good diet, take care of yourself, right?
Always a good idea.
All right.
Health is important.
That is so true. All right, let's talk tummy tucks. What can tummy tucks do for a woman's figure?
Well, tummy tucks, mostly we're doing them after childbirth or after weight loss, when there's laxity, there's looseness of the skin, and sometimes even the muscle of the abdomen. So with the tummy tuck, we're removing the lower skin from the belly to tighten all that up, and while we're there, we tighten up the muscles, kind of like an internal corset. So we build the foundation smoother and then tighten up the skin on the surface.
All right, who are the candidates for tummy tucks?
Again, someone who's in good weight, good shape, who's close to their ideal weight. What happens if we're really overweight, and unfortunately for me, it's more common in men than women, men tend to put fat inside first. So the fat tends to be behind the muscle, and I can't get to that with a tummy tuck. So if the fat's on the outside, which is more common in women, we can get rid of it at the same time. The problem with fat inside is, as we're trying to tighten the muscle, it's kind of like trying to close a suitcase that's overstuffed. I can't make the abdomen as flat as I want to because there's too much behind the muscle wall.
Oh, wow.
So good to be close to the ideal weight. That's why childbirth is one of the more common reasons why we do this, because that weight goes away with childbirth for the most part, at least the stuff on the inside. And then on the outside, if there's a little bit of fat in the lower abdomen, that skin we're removing anyway, so it tends to go right away.
I want to talk mommy makeovers in just a minute, but first I want to give everybody the phone number again if they want to talk to the doctor right now, 415-561-8753. It's right there on your screen. All right, let's go to before and after photos for tummy tuck, shall we? What are we seeing? Let's take a look. First one.
And you can see people come in all shapes and sizes, so this is someone who's pretty close to her ideal weight, has some laxity, some sort of loose, scrunched up skin around the belly button.
Creping
which,
a little?
Yeah, she really didn't like. So what I've done is a tummy tuck, remove the skin from the lower part of the abdomen. The belly button is still hers. What I've done is remove the area where the belly button was, bring that down, and made a new buttonhole for the belly button to come through. And it tightens it up very well.
It's beautiful. Here's another one. What are we seeing? Same patient?
So same idea. This is the side view, so you can see the abdomen's been brought back. The rectus muscle, which is that little shadow you see on the side, those get pulled together because we've tightened up the center. So it actually makes the body look a little more cut, and it also brings the muscles into a more powerful position, so it's a more, a better position in terms of getting up and moving around and exercising.
So I won't have to use the powder to make those lines, you know? I can actually get them, right?
You can draw them on, or you can
What about this picture?
So same idea. This is someone with a little bit more stuffing, so we've removed a little bit more. And again, we can tighten up the abdomen, make things nice and smooth.
What about stretch marks? I know I'm off topic, but is there anything to do about stretch marks?
I wish we had a magic way for stretch marks. The stretch marks, though, they're in the lower abdomen, go away with the skin.
Oh, they do?
So if they're confined to that area, they're gone. If they're above the belly button or off to the side, can't usually get rid of all of those.
We have one more picture here, it looks like.
So again, from the front, this is someone obviously in really good shape. You can even see her six-pack before the surgery, but there's that lower skin at the bottom and a funny draping above the belly button. So that just gets rid of all that. And I've still tightened her rectus muscles. You can see the distance between them is smaller now because I've tightened up the abdomen.
Wonderful. And what about the scar? Before we take a phone call, scar?
So there's a small scar around the belly button, so it's kind of hidden in the shadow there.
Oh, nice.
And then there's a scar that runs usually from hip to hip, just below the bikini line. And I try and keep that really low so it's not seen.
Wonderful. All right, Lisa from San Jose has a question for the doctor. Lisa, are you on the air?
Yes, I am. Hello.
Hi, Lisa. Hi. What's your question?
My question is regarding body lift after gastric bypass surgery or tummy tuck.
Yes. Body lift, very similar to a tummy tuck, except that it's extended all the way around, so that we can remove sort of a belt of skin and the fat that's behind that skin. And it allows us to tighten up the abdomen like we saw in the before and after pictures, but also tighten up the back. So when there's extra skin or draping of the skin, we can lift that, and it tends to lift the buttocks too.
Really?
So it's a bigger procedure.
It's like pantyhose. It's like lifting all that skin on your legs
like,
too.
yeah.
Everything comes up. You know, Sharon Osbourne had one of those.
Oh, a lower body lift?
Yes, and I mean, but you cut all the way around. So
Yes.
what's the recovery time on that?
Recovery time surprisingly is similar to a tummy tuck.
Really?
For some reason, the back doesn't tend to bother people as much as the front. And I think it may be because we're tightening up the muscles in the front, whereas in the back, we're just removing skin and fat, and that tends not to bother folks as much.
And what about the scar on a body lift?
So body lift, it's the same as the tummy tuck, but it extends all the way around. And usually we kind of bring it to a little V on the upper part of the buttocks. It can be done as one procedure, and usually I'll keep people overnight if we're doing that.
Okay.
It can also be divided. Sometimes we'll do the tummy and then come back and say, oh yeah, the back's bugging me enough, we'll do the back. And we can stage it that way too.
All right, I got to ask you about mini tummy tucks when we come back, but we got to come back in just a minute. If you need more information about Dr. Mealy, you can call 925, I said Mealy, it's Mealy, 925-943-6353. Check him out on the web at either drmealy.com, sanfranciscobreast.com, or at sanfranciscoplasticsurgeryblog.com. We'll be right back on Body Beautiful.